audio with a video to be mashed together. Yeah, I think I'll be going in next. I'm supposed to be the third speaker, but I think I have to go in now. Okay. Hi guys. Good evening, good afternoon, good morning, anywhere you are from the world. I am Alasa Mohammed. Now, Solving Medical Conditions is an online clinic where we educate, diagnose, treat people on their health issues, because there are so many things we do that are affecting our health. Some things that we do that we don't just know, we just do them because people do them, but they affect our health generally. So today we'll be talking about some things that our health that we do that don't affect that affect our health negatively, and how we can correct them. So I'm going to be sharing my screen with something for us to move along with, and I hope you can see this. So let's get started. Yeah, I hope you can see this now. First, we're talking about some detrimental actions in men, some things that men does that affect their health. Now, first, we all know the prostate issue, because most of the things we see now, we're having many issues of prostate cancer in men, and there's some things that men does that affect that making them having these prostate issues. Now, first, sitting down for too long. Now, as a man, you aren't meant to sit down in a position for too long, because once you are sitting, you are directly sitting on your prostrate. Now, what you have to do is once you have sat down in a position for too long, what do? You try to stand up, and once you stand up, then you walk around and you come, then you sit down back again. Now, that on prostrate. And again, concerning the prostrate also, your phones in your pocket. Now your phones, your phones have this, they emit this, when your phone is ringing, it's vibrating and it's emitting these rays. Now once this phone, because most of our phones are kept in our pocket, in our trousers pocket or our shirt pocket. Now if you check your shirt, you see that the pocket most times is on the left part of our chest, and if you check it in your trousers, is close to the male reproductive organ. You understand? Now, once this phone is ringing, it emits these rays, and once these rays get in contact with the prostate, also it affects your prostate. So please, it is called an handset. You understand? So you should be mostly you hold it in your hand, or you should get a kind of bag or a jacket for your phones. Okay, so that's that on that. And also the intake of excess carbohydrates also affects your prostate. But I'll be telling you more on that when we get to our diet, and I want to talk about things we eat. Now let's go to the next one. The next slide talks about the use of lipstick. Now most women use lipstick to make themselves more pretty, more beautiful, and stuff like it's perfect. But most of these lipstick are made from chemical substances. And let's say as a man, your wife comes back from work and you're like, hello honey, welcome, welcome. And next thing you try to hug her and you kiss her. Now you are directly licking off a lipstick. So once you're licking off that lipstick, also is that you are taking in the lipstick also, and once you do that for a long time, it accumulates and also affect your liver. You understand? And also for the women, also once you apply that lipstick, there's some food you eat that we have no that you cannot prevent it from touching your lipstick. Example, your gala. Once you're eating your gala, when you bite it, a part of your lipstick stains or touches the gala, which gives it that which give that stain of your lipstick on the gala. And once you eat it, you're also eating in the lipstick inside, you understand, which affects the liver also. So I would advise, if you must eat, you try to rub off your lipstick, then you eat. Then once you're done eating, you can reapply it. And also once you get home as a man, before you kiss your wife, also you try to clean off the lipstick then before you do the kissing. Yeah, let's go to the next slide. Now, withdrawal method during sexual intercourse. Now, withdrawal method is one of the family planning method in which a man try to withdraw his male reproductive organ when it's about to release, you understand, the woman, to prevent pregnancy. Now, during this period of withdrawal, there's some things that happen that most men don't take into consideration. We don't observe that. Now, once a man is having sexual intercourse, the most pleasurable part is when it's about ejaculating. That's when you have the highest of all climax. Now, when you're trying to ejaculate, now once you stop that action, not all the sperm comes out, you understand, because you have stopped an action that should bring out all sperms. Now, not all the sperms comes out, and there's some sperm that are left in there, you understand. Now, those sperms are, they are already left. What they are being stored in the epididymis, they are meant to be moved out of the body, but they are still in the body. So that can also lead to what testicular cancer also. You understand? So that should be noticed. Please, if you must do the withdrawal method, just try to make sure that you try to ejaculate all before you finish having your sexual intercourse. Now let's go to the next one. The next one is what? Wearing a tight or a black boxes. Now, as a man, normal wear our boxers as an underwear. You understand? It's normal, it's good. But you know that black as a color attract heat from the environment to the body. You understand? Normally, or like on a sunny day, for putting on a black cloth or a black shirt, you tend to sweat more than when you're putting on other colors of cloth because of what black attracts it. Now, imagine you wearing a black boxes and it's hot. Now, it's attracting more heat to the male reproductive organ. Now, the sperms in your testicles most times cannot survive above 38 degrees centigrade, you understand? Because once it's above that, they tend to die. That's why when God was creating us, he had to put the testicles outside the body because of the environmental temperature. So you can always cool off the sperms. And so once you are putting on your tight boxes, you are it's as if you're cooking your sperms, you're cooking your testicles. And if that is done for a long time, to cause death of the sperms, in which once a man starts ejaculating and is ejaculating dead sperms, and that can lead to infertility in men. So I would advise you, if you want to put on a boxer, make sure that it's not a tight boxers. Make sure you put in a boxer that your testicles are still allowed to dangle around a little and they can get space. You understand? So that's that on that. If you have a question, you can always send your questions via the chat section, and I will reply to all questions. The next one is what? Let's go to, because men are not that complicated. Let's go to women. I think women are more women are more complicated than men. So now, detrimental lifestyle in women. Now, first, like 80% of women always have issues with infection here, infection there, infection that. Now, there are so many things that causes infection in women. First, it's the pelvic inflammation disease. Now, some things that causes your infection, all these things are like bathing with soap, using tissues, using a pad for more than it. All these I've listed causes infection, but how? Now, follow me as I explain to you. Now, bathing with soap. Now, normally, you are meant to bath with soap to make you clean, but there's some part of your body that soap shouldn't touch, especially the vagina. Why? Because this soap contains chemicals. Now, these chemicals, what they do is that they tend to kill healthy bacteria. Now, in your vagina, there are healthy bacteria which shields the vagina itself to prevent invaders from invading other bad bacteria from coming into the female vagina. Now, once you have taken your bath and you have washed off those bacteria, it's as if it's just like a mansion that has no gate. There's no protection, so anything can come in, any infection. That's why a woman constantly having infection. Yes. So if you want to bath, just wash yourself, just wash your vagina with just warm water, you are good. Just ordinary water, you are good. And if you want to go extra mile, you can just do what they call the bucket therapy. If you want to know about bucket therapy, you can send a message, like a question. If I want to explain to you what bucket therapy means. Now, next of what, using tissue paper in place of a pad. Now, we know women always have this emergency, because there's some women that they have their menstrual period tabled out. Like, okay, this day of this month I'll be having menstruation. While some women, it just comes like uninvited guests, and they have to find a means to couple themselves together so they can get home and get a pad. Now, some women uses what is called a tissue paper. Now, using a tissue paper is a very, very wrong idea. Now, the nature of the female reproductive organ, the vagina, it is very sticky. Once you put anything, it sticks to it. Now, if you take a tissue paper, you try to fling it like this, that to fling it like this, what happens? You see that there are particles coming out. Now those particles are not the tissue paper itself. Those particles are the chemicals in the tissue paper. Now, if that particles touches the surface of the vagina, it sticks to the vagina. And once it sticks to the vagina, it dissolves in the vagina, and that can cause irritation to the vagina. Also, leads to pelvic inflammation disease. That is a PID also. Then also, so women use a pad for more than 8 hours. You shouldn't use a menstrual pad for more than 8 hours. Now, this pad, what it does is that it helps you to mop out or to soak the menstrual flow, the blood. Now, what makes it what makes it give it the ability to suck it out is the gel in between the pad. Just as you have a pad, you have a gel in between them and that pad together, in the sense to suck it in. Now, this pad, if you use it for more than 8 hours, what happens? This gel leak out. Now, once this gel leak out, these gel are made of chemicals also, understand. They have the capacity of irritating the vagina. And once this gel have direct contact with the vagina, it can lead to serious health issues, you understand. So it can lead to cervical cancer also. So you don't use your pad for more than 8 hours, maximum 6 hours, whether you're having a heavy flow or light flow. Make sure that once it's 6 hours, you have changed your pad and you're using another pad, you understand. Now the next is wearing a pant, that is your panties, for more than 24 hours. Now there's some women that they change their panties. Some women use, like in a day they use 2 panties, while some women use a pant for 3 days. Yeah, there's some women that does that maybe, I don't know, their hygiene is kind of bad, it's kind of poor. So the best is to use your panties twice. There is 2 panties for a day. Because first, now this is your vagina itself. Like some vagina itself, it has its natural smell, its natural fragrance. You understand? But once you use it, oh, my dogs, leave my dogs alone. So oh my God. Okay, once you use it for so long, now this panties itself gives the vagina, it has this odor because of the heat. You understand? The heat, because the vagina itself, it's an organ also it has it's sweat also. Now once this heat is too much, it start giving the vagina an awful odor that starts smelling. Understand? That what cause smelly vagina. So once you want to try to change your panties twice daily, you try to you are reducing your patterns from giving your vagina that kind of bad odor. So please and please, you have to do change your panties at least twice in a day. Now, and also wearing of black panties. I remember when I told you about the men that wearing the black boxes, that black actually attract heat from the environment. The same thing applies to women. Now, when a black thick pant is not advisable because of the heat also. If you must wear a black panties, make sure you're wearing a netty black pant. When I mean netty, a pant that's having net, so you can have hair coming in to reduce the temperature of the environment of the vagina. That will also help. So if all these things can be put to place also, I think the issue of having PID will be reduced because you're having a better hygiene, and I think your vagina deserves more and deserves better. Now let's go to something that our diet. Let's go and let's see what our diet should look like and what we have been experiencing and what our diet will make us if we eat better, and if you eat bad, and what our diet will make us look if we eat bad. Now this is the food pyramid. The food pyramid is a pyramid that shows the daily quantity and quality of food that you take in a day. That is daily intake of the food. Now first it says carbohydrate 5%, protein 15%, fruit, vegetable 30%, whole grains 50%. Wow, whole grain 50%. That's much. But I will explain to you how this works and some health issues that actually go with our food, because if you eat some things wrongly, it's kind of detrimental to your health. Now, talking about carbohydrate, we all know carbohydrate, and most of the food we eat are carbohydrates. Now, carbohydrate includes your rice, your bread, your starch. Most of the food we eat are carbohydrates. And when we say 5% carbohydrate, means you should eat your carbohydrate so little. A 5% carbohydrate can be a very little something. And some people say, I want more, but that thing is you should eat what? A little carbohydrate, because now your carbohydrate, once it's taken to your system, it's combined into glucose, you understand? Now, glucose is also known as sugar. Now, once you load your system with excess sugar, that's what? Diabetes, you understand? Now, they are what they call the type 2 diabetes, which is also called dietary diabetes, which you got from what? From what? Our diet, which is also the carbohydrate, because once you load your system with enough carbohydrates, now what they call the pancreas. The pancreas emits secrete two enzymes. You have your insulin and glucagon. Now, once you load your system with too much carbohydrates, which later converted to glucose, your insulin does what? Helps you what? Bringing on the carbohydrate by what? Storing and bringing out the insulin does what? The bringing down of the blood sugar level. But once I've done it for a long time, the insulin gets weak and get tired, because it wants to do something over and over again. It gets frustrated and get tired, and the insulin just take a break. I want the insulin take a break, and that gives you a shooting of the blood sugar level, and they say, oh, it's having diabetes. You understand? That boils down to what we eat also. So if we can eat moderately, take little carbohydrates and more of protein and other food, I think we'll not have more issues of what? Diabetes. Now, let's go to protein. Now, one of proteins. Proteins are the block builders of life, or life building blocks in our health. Now, there are we know some proteins, but there are some proteins that are actually very good, and some proteins that are good, and there's some proteins that are not good for your health, depending your age. But we'll get to explain all to you now. Now, first, talking about protein, what they call the plant protein and the animal protein. Now, the plant protein, we all know plants. Anything that come from plants, which are your beans, your lettuce, your legumes, you understand? Those are your plant protein. Then animal proteins are protein that come from animals. Now, example are your meat, your fish, your egg, your anything come from animals. Those are your animal protein. Now, which is the best protein to take? The plant or the animal protein? I think it's the plant protein. Now, the plant protein are the best type of protein to take, because the animal proteins always have issues when you take them, depending on your age. Now, let's go to the meat. Do you know that for your normal meat, it takes at least 6 to 8 hours to digest a piece of meat? Now, why stressing your digestive system when you load your cell system with a lot of meat? It doesn't make sense. Just because you want to have protein in your system, your digestive tract have to work for the next 6 to 8 hours. No, that's bad. Now, let's go to the next one. Egg. Now, when we're growing up, we always hear people say, you have to take an egg for a day, or one egg for one day. It's perfect. But for children, for adults, to be an egg for a week, because your egg, once you take your egg so long, it has this cholesterol in it. And once you have taken your cholesterol for so long, it's what they call the good cholesterol and the bad cholesterol. But what you get from egg are actually the bad cholesterol. Once you take it for so long, it's thinning your blood vessels, and also what covers your heart, in which your heart wouldn't have enough space to expand, you understand? So that can lead to what? High blood pressure, and also it can lead to what? Stroke, just from your protein also. So I think plant protein are the best. But let's go to your plant protein now. Your beans, it's perfect. If you take your plant protein, which is beans, which is beans, or any kind of plant protein you're taking, I think it's better than going for what? Your animal protein. Same as the milk also. Your milk also contains cholesterol also. So I will advise you go with your plant protein. Now let's go to fruit and vegetables. Now, 30%. You see that your fruit and vegetable should be taking more than your carbohydrate and protein mixed together. You understand? So your fruit and vegetable. Now, in this part, in the part of the country, part of our world that is in Western in Africa, we don't eat a lot of fruit. You understand? We only eat fruit when it's time for celebration or once in a while. We don't just eat fruit. Now, you should eat your fruit more than how you eat your food. Why? Because your fruit does a lot. Kindly let's try to put off our microphone, please. Try to mute your microphone, please. Kindly mute your microphone, please. Yeah, thank you very much. Let's get along. Now, fruit and vegetable, they give your fruit and vegetable contains a lot of vitamins, and these vitamins are necessary in your system. Now, what are these vitamins? You have your vitamin A, your vitamin C, your vitamin D, your vitamin E. Kindly let's try to mute our let's try to mute our microphone, please. Yeah, thank you very much. Now, what does this vitamins do, and what food do we get from this vitamin? What kind of food? Now I'm talking about vitamin A. Now vitamin A, it's perfect. Please, 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 your microphone disactivate, please. Now, talking about your vitamin A. Now, vitamin A is very good for your eyes. Now, what kind of food do you what kind of food can you get vitamin A? Your carrot. Your carrot, you get your vitamin A from your carrot. Now, if you're having issues with your eyes, or you're using glasses, or you're using lens, if you take more of carrot, it will actually help your eyes because of what is having vitamin A, which your eyes actually needs. Now, let's go to vitamin C. Now, the vitamin C, it helps prevent scobic. It's having citric acid, which also help preventing scoby. Now, the vitamin C can be getting from any citrus family. Citrus, you have your orange, your tangerine, anything having citrus gives you vitamin C. Now, your vitamin E, they are very good. Now, all vitamins are good, but your vitamin E does more functions, which are what? Mopping out excess free radicals. Now, the question is this: what are free radicals? Now, free radicals are what? Cancer causing agents. Those are the things that causes cancer, and you pick them off from your environment, which can include smoke and other things. Now, what the vitamin E does is what it goes in and what mop those free radicals up, in which so they don't try to play with your cells, because once they're in your system, they try to play with your cells, and once they play with your cells start growing abnormally. And once start growing abnormally, that what leads to what? Cancer. So the vitamin E mops out these free radicals. Now, what fruit can you get from your vitamin E? You can actually get your cucumber, you get your vitamin E, your watermelon also. And talking about watermelon, that's what they call washing the system, how to purify your system health-wise. Now, we can do that with watermelon. What you have to do is what? Eating of watermelon, but there's a way you eat it. You eat everything together. You eat the fruit itself, the seeds itself, and the back of the watermelon. You eat everything together, but please and please try to what? Chew them, masticate them. That is, you have to chew them properly well. Then after you take them, you take a glass of water. That water will help what? Flush out your system. It is very, very good for your system. Then let's go to whole grains. Wow, 50%. The other pata pata. Now, talking about whole grains. Now, why is this whole grain? Why is it so much? Why should we take whole grain 50% when there are other things to take? Now, let's see. Now, whole grains does a lot of function, which include mopping out excess cholesterol and mopping out excess glucose in your system. If you have a food that can actually do this, then that means that we'll not be having more cases of diabetes and hypertension or even stroke. So now, what are these foods that fall into whole grains? Now, whole grain foods are food mostly that are having their how do I put it, that they're having this back in them. Now, example, your wheat is an whole grain, you understand? Your oat is an whole grain. Then what they call your basmati rice, Sometimes in Nigeria, we call it the ofada rice, you understand? Those are whole grains, your millet, your soy, they are whole grains, you understand? Now, if these whole grains can be taken more, then you have better health. Now, you know that with this whole grain, you can actually base your food on whole grains, you understand? Let's say, for instance, you love carbohydrate and you love taking rice, you can switch from rice and you go to taking um, that basmati rice, which is your father rice or any kind of rice, you understand? You switch to that. That's helped in eliminating the amount of carbohydrates you should be taking in with your basmati rice. If you're a person that loves taking either pap or something, you switch it to oats, you understand? Now, oats also will help you in switching off, taking off carbohydrate from the menu also. Then also now there's some person that in Africa will eat a lot of food that is, we call them swallows, food that you eat with soups. Now you can make your whole grains blending your blending your millet, by blending your stuffs, making those kind of swallow which you can take, which also help you in eradicating taking excess carbohydrates. Understand that now you can see that whole grain does more functions in which it helps you in having a better health. Now, in talking about diet, health, and lifestyle also, now your lifestyle also, please, your exercise is always needed. You understand? You need to have a lot, you have to take more exercise, do a lot of exercise, and also try to always visit your doctor, do a regular checkup, because your checkup is very, very important. Because if you don't check yourself up, you wouldn't know what's happening in your system. Because it's better to know when it's happening when it's just new than when it has gotten to the extreme. Understand? So that is perfect. So